looking at the possibility of rolling over any money that was not spent from the previous year, and then allowing that money to be banked for each employee's household. And then there'll be a cap on that. We're trying to determine that right now. The reason I bring this to you right now, I want to make sure that this is something the board would like to move forward on and look at. Because right now, if you're an employee that has, say, 2 children, and one's going to have to get braces, $1,500 does not go very far in getting braces. If they want to bank that money for a year or two to assist them with doing that, I think it'd be a good idea. The question is the amounts that we're talking about and what's the cap as it relates to per household. So that's the items that we're working on internally. And so in the middle of that conversation with Carrie and Matt and Lynn, something dawned on me was this is something we need to get confirmation on from the board to make sure that this is something they would support if we would move forward with this, or if it's something they're interested in.
Okay, it's an interesting idea. I've got 2 thoughts on that. One is when you have the use it or lose it, policy that we currently have, sometimes you can be incentivized to like purchase or use benefits you don't necessarily like. The vision, you say, well, I'm going to get a new pair of prescription glasses,
right,
even though the ones I have are fine, but so in one way it sounds like it's nothing but going to cost money, but on the other hand, people may actually bankroll it towards something they actually know they're going to need.
Right.
So if we've already budgeted for that, maybe it's not really costing us anything in the big scheme of things, if that makes sense. So I don't see any objection to entertaining this at all.
Thanks, sir.
It's an interesting idea.
So, per what Bob just said, is it totally funded? What cost is it the airport to track this?
No, right now, each member of the household gets $1,500. And at the end of the year, if what's number's not used, is lost. What we're recommending is that we determine an amount that is available to be rolled over and capped after a certain amount of time. We don't want to put ourselves in a position where it's just indefinite, because that would put an unfunded liability, or could put an unfunded liability on us. We don't want to do that. But I think more than $1,500 per person annually is definitely something worth looking at. What that number is, like I said, we're trying to determine what that is and what the cap should be, and right now, again, it's $1,500 per person in each household. It's not per employee. So if you have a family that has a husband and a wife, and I'm just going to throw in, say you have 4 kids, well, then you roll that over a couple years, you're into significant money. So it might mean reducing the annual amount and capping it after 5 years, where each household, making it a household cap of $5,000 or $7,000, or it may be increasing the amount and making that cap level such that you're going to achieve that after only 1 or 2 years. So there's a lot of things to look at. We've got a lot of spreadsheets going on with that. But like I said, getting really deep into it, really into the weeds, I'm thinking, I don't want to get down this road, and all of a sudden the board says, this is a terrible idea. And that's why I just want to bring to y'all's attention.
Yeah. So my only concern, right, is if we have, say, 90% of it goes unspent, and then if it rolls over, that can get us sideways.
Right.
So,
Yes.
Yeah.
Right.
Yeah. I have no objections.
What do you mean by that? Get us sideways?
Well, not in a grand sense, but just in that if you have a great deal of money saved up that normally beneficiaries would not have spent, and now they have access to be able to do so, just in the long run, it may turn into a very different spending habit. Now, that could be perfectly acceptable. This would be a great way to help out parents whose kids need braces and that kind of thing. Just as long as this doesn't wind up, at an amount that is surprising and binding, is all.
Right, exactly.
We don't want an unfunded liability. That's 90% of what's wrong with the county and everybody else. make all this money available, and now the fire department's trying to raise the rates on all communities around here because they got so much money tied up in their retirement programs that the board of supervisors gave them instead of a wage increase.
I agree with Bill. I know exactly what he's saying.
Chuck, do you have a comment?
Not this time, no.
All right.
If you have 30, I'm sorry, go ahead.
Okay. I've thought about this for quite a few years. I've asked retired employees. I said, when are we going to increase the amount? Why can't we roll it over? All this stuff. I'm the one that actually kind of brought this to the attention. My thinking is it is a budgeted item. We vote on it every year. I try to watch our liabilities and stuff like this, and I tend to favor something like this over raising it if we wanted to raise it. I don't think there's many people that would want to reduce it because we've been to the dentist in the last 5 years. That $1,000 crown is now $1,800.
Yep.
But anyway, so my thinking was to, and this is only the previous year. So let's just say this year, and let's say Diane goes along and she uses $1,000 of her dental. Next year, that $500 balance is carried over to her 15, so now she has $2,000. So maybe she can do a little more dental or eyes. I think eventually, as you take care of yourself, my wife didn't use any last year. She probably needs a crown, but we'll just deal with it this year. But anyway, I just think it's a nice way to do it. It isn't a financial impact to me. I don't want to raise the amount. I don't want to carry it 2 or 3 or 4 years. I think it becomes an accounting nightmare for staff to try and figure that out. But I'm in support of it.
Very good. Any other comments? Chuck, do you have any comments?
No, I don't. Thank you.
Hearing none, moving on. Last items on the list. Speaking of liability, our aviation and control tower general liability, stroke check $35,165 for insurance. We entered into a couple of leases, one for here 937, one for building 83. Those are both month to month. That concludes my report. Thank you.
Did our insurance go up from last year?
You know, Carrie, did our insurance go up from last year?
They'll pay insurance at most.
I just think as a comment, over the past years, we depended on one particular broker and bought a significant amount of insurance from them. And the board, in its wisdom at the time, directed staff to go out and shop it, which we've done over the years, and I think significantly decreased that savings. Anyway, my point is, it's good to shop insurance. I do it myself, and it's amazing how much money you can save. It seems like there's a built-in escalation every year. Homeowners is a good example. And all of a sudden, we built 2 houses. They're not going to do that.
Most public agencies shop their insurance about every 5 years if they haven't done.
Yeah.
And I think it's a good idea.
Thank you, Todd.
Sir. Thank you.
We have no board committees, board of director. This portion of the meeting is reserved for board members to comment on items not on the agenda. I think our bill shot entry looks nice now that the trees are being watered and are green. You know, and the ball field's coming to life.
Yes, sir.
Uh-huh.
We're getting there one step at a time.
Yeah, all right. Public comments. Members of the public may comment to the board on items not on the agenda. Are there any public comments? Is anyone out there? Unmute your mic. All right, none being. Thank you everyone for attending today. Next we'll move into closed session.
Recording stopped.
Thank you for coming out, y'all.
Thank you, Jason.
And I don't know if you're aware that actually sending quotes, but the directors are also with that same.